Colon cancer, also known as colorectal cancer when it affects both the colon and the rectum, is one of the leading causes of cancer-related deaths worldwide. The disease often develops slowly over several years, beginning as a benign growth called a polyp, which can eventually become cancerous if left untreated. Understanding the symptoms of colon cancer is crucial because early detection dramatically improves the chances of successful treatment and survival. Unfortunately, in its early stages, colon cancer may not cause any obvious signs. That's why both symptom awareness and regular screening play essential roles in saving lives. In the initial stages, symptoms can be subtle and easily mistaken for other less serious conditions such as irritable bowel syndrome or hemorrhoids. Some of the early warning signs include persistent changes in bowel habits. This can involve diarrhea, constipation, or a change in stool consistency that lasts for more than a few days. Rectal bleeding or blood in the stool. The presence of bright red blood or darker, tarry stools can indicate bleeding within the colon. Abdominal discomfort, ongoing cramping, bloating, or pain may signal a problem within the digestive tract. A feeling that the bowel does not empty completely. This can create constant discomfort and an urge to have a bowel movement, and even after doing so. Recognizing these early signs is critical because intervention at this stage often leads to the most favorable outcomes. As colon cancer progresses, the symptoms tend to become more noticeable and severe. Advanced signs and symptoms may include significant and unexplained weight loss. Cancer cells consume a lot of the body's energy, and tumors can release substances that alter metabolism, leading to rapid weight loss. Chronic fatigue and weakness. Ongoing blood loss from the tumor can lead to anemia, resulting in persistent tiredness, weakness, and shortness of breath. Severe abdominal pain. As the tumor grows, it can cause a blockage in the intestine, leading to severe pain, vomiting, and sometimes an inability to pass stool or gas. Narrow stools. A tumor can constrict the bowel, leading to pencil-thin stools. Iron deficiency anemia. Unexplained anemia discovered during a routine blood test could be an early clue, especially in older adults. It is important to note that symptoms may vary depending on the size of the cancer and its location within the colon or rectum. Certain factors increase the risk of developing colon cancer, and therefore the likelihood of experiencing its symptoms. These include age over 45, a personal or family history of colorectal cancer or polyps, a history of inflammatory intestinal conditions such as Crohn's disease or ulcerative colitis, a sedentary lifestyle, a diet low in fiber and high in fat, smoking and heavy alcohol use, obesity, type 2 diabetes. Being aware of these risk factors can prompt earlier discussions with a healthcare provider and encourage timely screenings. If you notice any persistent symptoms such as changes in bowel habits, blood in the stool, unexplained weight loss, or ongoing abdominal pain, it is important to seek medical advice. Even if these symptoms are caused by something other than cancer, such as hemorrhoids or an infection, a proper diagnosis is crucial. Healthcare providers may recommend diagnostic procedures such as colonoscopy, a comprehensive examination of the colon and rectum using a flexible camera, CT colonography, also known as virtual colonoscopy, a less invasive imaging method to visualize the colon, stool tests. These can detect blood or abnormal DNA associated with cancer. Early-stage colon cancer is often asymptomatic, which is why routine screening is essential, particularly for individuals at higher risk. When detected early, colon cancer is highly treatable, often with simple surgical removal of the cancerous polyp or tumor. Survival rates are significantly higher when the disease is caught before it spreads beyond the colon or rectum. For example, the 5-year relative survival rate for localized colon cancer, which means cancer that has not spread, is about 90%. However, if cancer has spread to distant parts of the body, the 5-year survival rate drops to around 15%. This highlights the life-saving importance of not only being aware of symptoms, but also participating in routine screening programs. Colon cancer is a serious disease, but it is also one of the most preventable and treatable forms of cancer if detected early. Paying attention to symptoms like persistent changes in bowel habits, blood in the stool, unexplained fatigue, and weight loss can make a critical difference. Don't ignore any concerning symptoms. Consult a healthcare professional promptly. Moreover, follow recommended screening guidelines, maintain a healthy diet rich in fiber, exercise regularly, avoid smoking and limit alcohol consumption to reduce your risk. Awareness saves lives. Stay informed, stay proactive.